state's largest healthcare facility as the negotiations continue in hopes of averting a walkout that could mean thousands on the picket line. Good afternoon, I'm Pat Masters. First on 12 this noontime, nurses at Rhode Island Hospital continue contract talks with management. It's a familiar battle cry from the workers who say they will not be forced to work hours of overtime that they say could ultimately affect the quality of patient care. 12 News reporter Karen Southern is following today's developments, and she joins us now from Providence with the latest. Good afternoon, Karen.
Good afternoon, Pat. The president of the union that represents those 1,700 nurses and other hospital employees told me this morning that the two sides are not even close. They're up there right now on the second floor in that conference room trying to iron out a contract agreement. They have been at it since about 10 o'clock this morning.
Let's see what's going on.
They're giving it another shot. Negotiators for both sides headed back to the bargaining table at the Days Inn in Providence, trying to strike a deal. What are your feelings going into this morning's talk?
I have a feeling of apprehension. It's getting down to July 1st. We have a lot of families at stake. We have a Rhode Island population of patients at stake.
Also at stake, their fight against mandatory overtime. Union nurses and other healthcare workers took their message to the streets yesterday in a rally outside Rhode Island Hospital.
President of this local who works night and day.
The 1,700 hospital employees say they want the right to go home when their shift is over at the end of the day. But hospital administrators say mandatory overtime is necessary to ensure patient care, with staff members calling sick and in other emergency situations.
The answer is very clear, that it's a budget problem, that the budgets are set unrealistically low.
Rhode Island hospital officials are said to be ironing out a contingency plan just in case the nurses go on strike. The health department is monitoring that situation, so is Governor Lincoln Almond. In fact, the president of the union met with the governor this morning. A spokesperson from his office says he's getting updated on the situation, but he is not ready to intervene. Live in Providence, Karen Southern, 12 News.
All right, thank you, Karen. Yesterday, nurses received the support of the Teamsters employees at the hospital and nurses from the former St. Vincent Hospital in Worcester. You may recall they, too, fought mandatory overtime in their contract and won.
I would like the governor and other officials who have been coming forward to talk with us and understand our issues, so that if they're so inclined, they can, try to encourage a settlement.
Now, we asked McDonald how she felt going into the talks today, and the word apprehension was used with the contract expiration coming a week from today and the strike scheduled for July 1st. So there's really going to be a race against time with the two sides so far apart, especially on that mandatory overtime issue. So in other developments today, the State Health Department staff members from the department will be touring Rhode Island Hospital. A detailed operational review as part of its review of the hospital's contingency plan. We'll, of course, continue to follow developments throughout the day and bring you the latest beginning tonight at 5.